Hey guys, my name is Michael Rodriguez.
My name is Jasmin Torres.
Our class is Anatomy and Physiology 2A.
The purpose of this video is to show body movements and the joints and muscles involved.
Our first movement was flexion. The selected joint is the glenohumeral joint. The muscles involved are the deltoid, trapezius, pectoralis major, and the biceps brachii. The agonist is the deltoid, and the antagonist is the biceps brachii. The plane this movement takes place is the sagittal plane, and a real-world application would be raising your hand to ask a question.
Our second movement is extension. The selected joint is the glenohumeral joint, and the muscles involved are the teres major, the deltoid, and the latissimus. The agonist is the deltoid, and the antagonist is the teres major. The movement takes place in the sagittal plane. A real-world application is giving someone a coffee mug. Our third movement is abduction. The selected joint is hip joint. The muscles involved are sartorius, tensor fasciae latae, adductor muscles, deltoid, and pectoralis major. There is no agonist, and the antagonist is the adductor muscles and the sartorius. This movement takes place in the frontal plane, and a real-world application is the open position with jumping jacks. Our fourth movement is adduction. The selected joint is acetabular femoral joint, and the muscles involved are the adductor brevis, pectineus, adductor longus, gracilis. There is no agonist, and the antagonist is adductor longus, gracilis, and the pectineus. The movement takes place in the frontal plane. A real-world application is the closed position in jumping jacks.
Our fifth movement is dorsiflexion. The selected joint is the talocrural joint, and the muscles involved are the hallucis longus, tibialis anterior, and the extensor digitorum longus. The agonist is the tibialis anterior, and the antagonist is the extensor digitorum longus. This movement takes place in the sagittal plane, and a real-world application would be when you get a cramp.
Our sixth movement is the plantar flexion. The selected joint is the talocrural joint. The muscles involved are the tibialis posterior, soleus, flexor digitorum longus, gastrocnemius, and fibularis longus. The agonist is the gastrocnemius and the soleus. The antagonist is the tibialis posterior, the flexor digitorum longus, and the fibularis longus. This movement takes place in the sagittal plane. The real-world application would be pressing on a gas pedal. Our seventh movement is circumduction. The selected joint is metacarpal phalangeal joint. The muscles involved are the dorsal interossi and the palmar interossi. The agonist is the dorsal interossi, and the antagonist is the palmar interossi. This movement takes place in multiple planes, and the real-world application is stirring coffee.
Our eighth movement is eversion. The selected joint is the intertarsal joint, and the muscles involved are the fibularis longus and fibularis brevis. There is no agonist, and the antagonist is the fibularis longus and fibularis brevis. This movement takes place in the frontal plane, and a real-world application would be tapping your foot to a song. Our ninth movement is hyperextension. The selected joint is the atlanto-occipital joint, and the muscles involved are the trapezius and platysma. The agonist is the trapezius, and the antagonist is the platysma. This movement takes place in the sagittal plane, and a real-world application would be looking at ceilings. Our 10th movement is inversion. The selected joint is the subtalar joint. The muscles involved are the soleus, gastrocnemius, and tibialis anterior. The agonist is the gastrocnemius, and the antagonist is the soleus. This movement takes place in the frontal plane, and a real-world application would be dancing to Footloose.
Our 11th movement is lateral rotation. Our selected joint is taliotarsal joint. The muscles involved are the soleus, gastrocnemius, and the tibialis anterior. The agonist is the gastrocnemius, and the antagonist is the soleus. This movement takes place in the transverse plane, and the real-world application is when we're in a really small place and you have to turn your feet to get in.
Our 12th movement is medial rotation. The selected joint is the glenohumeral joint, and the muscles involved are the vastus medialis, vastus lateralis, and rectus femur. The agonist is the vastus medialis, and the antagonist is the rectus femur. This movement takes place in the transverse plane, and a real-world application would be doing the Millie Rock. Our 13th movement is opposition. The selected joint is the carpo-metacarpal joint, and the muscles involved are the opponens pollicis. The agonist is the flexor pollicis brevis, and the antagonist is the adductor pollicis brevis. This movement takes place in multiple planes, and a real-world application would be doing the OK sign. Our 14th movement is radial deviation. The selected joint is the radiocarpal joint. The muscles involved are the flexor carpi radialis. The agonist is the extensor carpi radialis, and the antagonists are the ulnar deviators. This movement takes place in the frontal plane, and a real-world application would be waving.
Our 15th movement is supination. The selected joint is the distal-radial ulnar joint. The muscles involved are the brachioradialis, the brachios, and the biceps brachii. The agonist is the brachioradialis, and the antagonist is there are none. This movement takes place in the transverse plane, and the real-world application will be holding up some soup in a mug. Our 16th movement is the ulnar deviation. The selected joint is the metacarpophalangeal joints. The muscles involved are the flexor carpi ulnaris, and the agonist is the external carpi ulnaris. The antagonists are the radial deviators, and this movement takes place in the frontal plane. A real-world application will be covering your eyes from the sun. Our 17th movement is pronation. The selected joint is the proximal radial ulnar joint. The muscles involved are the pronator teres. The agonist is the pronator quadratus, and the antagonists are the biceps brachii. This movement takes place in the transverse plane, and a real-world application will be dumping coffee into the sink.